Hello, my name is Justin. I'm a doctor of physical therapy student. I'm going to be helping you out today.
Okay.
So I was doing a little bit of homework on you, reading up on your notes. I read that you had some back pain. Could you tell me about that, like when it started, and then just kind of the progression of that, and just describe it a little bit?
Yeah. So my back's been hurting. I want to say it started like 3 weeks ago.
3 weeks ago?
I was helping my wife lift some boxes, and I think I just picked up a really heavy box. And just like while I was lifting it and carrying it, started to notice some pain in my back. But I didn't really think much of it. But
Okay.
since then, it's been pretty bad. It's been getting worse, I would
Getting
say.
worse, okay. On a scale of 0 to 10, right now when you're sitting, what would you feel it like, or rate it as?
Right now, just sitting, I would say it's maybe like a 2.
2? Okay.
Yeah.
10 being like the emergency room, 2 being, or 0 being nothing, like a 2?
I would say it's a 2.
Okay, perfect. Could you show me where you feel the pain right now?
Yeah, I kind of feel it right here on this right side.
Right there on the right. Could you stand up for me?
Yeah. So I kind of feel it like right there.
Okay, can I lift up your shirt?
Yeah.
Okay. So right in this region
Yeah.
area? Okay. How about going up?
Nothing.
No?
going up.
Okay, anything going down the leg here, down the buttock, down the side of your leg, anything towards the front of the body?
No.
And how about the other side? Same level, going up, going down?
Other side's fine.
Nothing? So you only feel the pain right here.
Right here for the most part.
Now, when you were rubbing it, did you feel like you can kind of touch it and kind of massage it out, or does it feel a little bit more deep?
No, it goes deeper.
Deep?
Yeah. Can't really get to it.
And does it still feel like a 2, or is it a little different now that
No,
you're standing?
Standing now that I've been standing for a while, I would say it's like a 5.
5? Okay. And did you notice that when you stand, is it always constantly painful when you're standing, or?
Yeah, I think standing is what really brings it on.
Okay.
More. I think standing is one thing that I notice is where I feel it the most.
Like all the time, or does it kind of come on and off?
No, I would say like every time I stand, I feel it a little bit, and then the longer I stand like that, then I start to feel it get to like
a little
5.
bit more.
Yeah.
Okay. How about any other things that make it hurt besides standing?
Besides standing, sometimes rolling over in bed.
Okay.
I feel it,
Okay.
just a quick rollover. It kind of comes on pretty
Okay.
quickly. But I would say, yeah, just rolling over and standing up.
Okay.
And standing.
Gotcha. So I'm a little bit confused because you said you had a little bit of pain when you're sitting, but it seems like it's less. So are you still feeling pain while you're sitting right now, or?
Yeah, I would say right now it's maybe a 2 going to a 1. I think
Okay.
the longer I sit, eventually it gets to a 0.
Okay, so
Yeah.
it does get to a 0 at some point.
Yeah.
Gotcha. What other positions or things make it disappear or make it feel better?
I would say sitting's the main thing, and then sometimes when I walk, once I start walking, I feel the pain kind of go away as well.
Okay, so walking makes it feel better, sitting makes it feel better. Is there anything else besides that?
No, I would say those are the 2 main.
Okay, gotcha. And so I want to talk about your pain a little bit. When you stand, do you feel the pain immediately? Does it take a couple seconds? Does it take like a minute, or like how long does it take?
I would say I feel it kind of right away going into my stand, and then the longer I stand, it probably gets worse. I would say maybe
What's
like
the worst?
30 seconds. I think the worst is probably like a 5 or 6.
Okay.
Yeah.
So it immediately goes on. About 30 seconds, it kind of goes up to about a 5 or 6.
Yeah.
Does it get any higher than that?
No. I would say 5 or 6 is the highest.
And then when you start walking or sit back down, how fast does it come back down to like a 2 or a 0?
I would say it comes out pretty quickly, maybe like 30 seconds.
30 seconds?
Sitting
Okay.
down, it goes down to
Okay.
a 2 and then eventually to a 0.
Okay. So it seems like your pain kind of comes on really quick when you stand, and then when you sit or walk, then it kind of goes down a little bit. Yeah. Okay. And that pain, would you describe it as like a sharp pain, a dull pain? Could you describe that a little bit?
I would say it's more like achy, dull.
Achy? Okay,
Yeah.
achy, dull. And then when it comes on right away, is it still that achy, dull, or does that kind of ramp up to be?
I would say most of the time it's achy, dull, but it can be sharp sometimes.
Gotcha.
Yeah, if I go into like something really quickly, or if I'm turning in bed really quickly, I do feel it a little sharper.
Gotcha. Do you feel any radiating pain down the leg, like numbness, tingling, burning? Do you feel any of those sensations? Nothing down the leg, anything like that? No. Okay. Any differences from morning to nighttime? Like, does it feel worse in the morning or better as the day goes on? Like, can you describe that a little bit?
I want to say it probably feels a little better in the morning, but then when I get up, that's where I feel it. And then the more I stand throughout the day, it kind of gets worse.
Kind of gets worse. Okay. And then how about walking? We didn't really talk about that too much. Like, when you start walking, it just kind of disappears, like how you're sitting, or?
No, I would say like after I walk to like the mailbox, so maybe like 20, 30 feet, it starts to feel better.
Gotcha.
Yeah.
Gotcha. Okay. And then any trouble sleeping besides when you turn over to that side?
No, I think just turning, and then once I'm like laying down and I relax, I don't really feel it.
Okay. How many times are you waking up at night?
I would say like once or twice.
Okay. So like every night you're waking up once or twice a night?
Recently, yeah.
Okay. Okay. Gotcha. All right. And then so what do you do for work?
Right now I'm retired.
Okay.
I'm a retired teacher.
Okay. Very nice. So what do you do on your spare time, like hobbies, activities, exercise?
I walk the dog. I watch football, and then I just I try to help my wife with activities around the house.
Okay. Okay. So like, I don't know, like if she needs help moving stuff, like
Moving stuff. She likes to keep things clean and move things around, so I'm always helping her with the heavy stuff.
That's great. Always have a clean house. That's always good. Any of those activities that you mentioned, is the pain limiting you? Do you feel it with any of those activities?
I think just when I first lifted that box, and then lately, just like standing, like doing the dishes for a while, starts to hurt just because I'm like standing, like I said.
Yeah.
And anything like that, if I have to clean, if I reach up really high and I'm like standing, then I start to feel it too.
I see. I see. But it still never goes up the past like 6.
No, I would say that's the
pain.
highest.
That's the highest it goes. Okay, good. So I want to get a little bit more overall information from you. We're good about talking about the pain, but I want to go into more of like the medical stuff. So do you have any past medical history that I should be aware of, like high blood pressure, diabetes, any kind of hormonal issues? Not that you're hormonal or anything, but anything like that?
No.
No? All good, healthy. How about your family? Any family history?
I think like grandpa had high blood pressure, but that's
Okay.
about it.
Okay, good. And there's nothing else, no cancer, nothing that runs in the family?
No.
Okay. Have you had any imaging done for your back by any chance?
No. I went to my primary care doctor, and he just told me to come see physical therapy.
Okay, so no MRI, no X-ray. Just want to make sure there's no any fractures or any other source tissues that I should be aware of.
No.
Nope.
No.
And then, are you currently taking any medications?
No, I think I took like Advil like the first couple of days, but I
Okay.
haven't been taking that.
So you're no medications, no nothing like that. Okay. And then just the last couple questions. I just want to make sure everything is all cleared out. Any numbness or tingling in the saddle region?
No.
No, nothing like that. No trouble urinating or going number 2? Okay, great. Lastly, I wanted to ask you, what did you want to get out of physical therapy?
Basically, I just want to help my wife with all the chores that she needs. I want to be able to stand and not feel the pain.
Okay.
I definitely like to golf, and then that requires me to stand and move a lot. But I haven't tried it since hurting myself, just because I know for a fact it's gonna hurt.
Gotcha.
So I want to be able to feel confident being able to golf again and just doing everything around the house to help my wife.
Okay, perfect. All right, I just want to recap really quick. So you mainly feel the pain when you stand, it seems like. Standing is the biggest thing, especially like if you stand a little bit longer, it starts to go up. Gets to about like a 6 out of 10 pain. Things that make it feel better are sitting or walking, makes it feel better. Like 30 seconds, it starts to go away. You are waking up a couple times in the night, especially when you rotate towards that side.
The right side.
The right side. So, we want to make sure that you're still getting a good night's sleep, and that out of physical therapy, you want to make sure that your pain goes away and that you're still able to continue with your hobbies and help out around the house so that you have a happy wife, happy life, right?
You got it.
Perfect. Okay.